Afternoon, good morning, good evening, everybody. We're here at the Lummi Medical Center. As many of you know, the council receives a weekly update, and we got an update this week with our good friend, Dr. Kristina Toledo-Cornell. Doctor, good to see you. I'm going to step away and socially distance, but you got some news for the nation.
Yes,
Asian.
thank you. Thank you, Freddie. We have, well, first I want to just tell the community that we have doing really well. We hadn't had a case for 30 full days, so today we do have a new case, and I think that's somewhat expected. I wanted to first tell everyone how wonderful you all have been doing, and listen to what we've been asking people to do from the beginning. I know it's been a very long time, and people are getting tired, including myself, of having to be sheltering in place. But I want to take this opportunity to remind people that we are still, unfortunately, in the midst of this pandemic. The U.S. As a country is still on phase 1, and we could still see quite a lot of cases, deaths every day in the nation. We're getting close, probably the next week or two, potentially getting 200,000 people who have passed away from this illness. So it is still a very, very much threat to the whole country, but particularly to us, which is a small community where people are very close to one another and live in homes where our elders live with us. So that's why we ask people to really consider their risk and what they can do to help minimize that risk. One of the things that we've been talking a lot is that a lot of the current cases popping up around the country, a lot of it had been on the younger population, teenagers, even little kids. We had cases here at Lummi starting from less than 1 year old all the way to somebody in their 70s. So we had the whole spectrum of people getting ill from this condition. While kids may not be affected severely, they're still at risk. So we ask everyone to remember every time that you're out and about to wear your mask, have your kids, if they're old enough to wear a mask. My 3-year-old, she is a pro on wearing a mask, so I think that kids that age and above can be taught how to wear a mask safely. Mask, it really is the only proven current what we have to protect ourselves. So every time that you're out and about, make sure to put a mask on. If you're seeing people who you're usually not around, make sure you put a mask on. Going to the doctor, going to any sort of work environment, groceries, to have that on, because that's your only really mechanism of defense against others who may be affected and may not be protecting themselves so well.
To recap, we got one more case. Now that's case number
60.
60 cases.
Mm-hmm. 60 cases. Not all of those were Lummi community members, but I think 46 of those were Lummi community members. We do count all cases, including people who are relatives of Lummis who live here, who we tested, and some employees of the nation who were in contact with people, so we track those cases as well. We want the community to be safe no matter who is the person affected, so that's why we do that. One big thing though, that from all the cases that we've been looking at it, the 60 cases that we had, they always sort of involve some sort of gathering. So gathering is a big deal. If you are gathering with your families, we want people to keep that small, 5-10 people maximum. The smallest, the less risk. And outside, I know that the air has been horrible the last few days, but in general, we want people to be outside as much as they can and hold those activities outside. Because the air is not stagnant, the wind is moving, the risk of the virus coming to your nose is smaller, or your mouth or your eyes.
It's starting to clear up now.
Yeah, the air looks a little bit better today. I think yesterday when I looked, it was 226 particles per million in the air. Today it was down to 180, so not great, but better. Hopefully it's gonna rain again and keep clearing this up. But yeah, so we really want to say thank you for people who have been doing so amazing, and then to still be vigilant, because the pandemic is still here with us. Obviously, we have given this number 1,000 times out, but I can always wanted to give that number if there's always any concern Our public health line is 360-383-8251. I'm usually the person on call every evening and every weekend, so you reach me or one of my staff during the day.
And you said 360?
383-8251.
8251. Well, we're here at day, what did I say earlier? 191 shelter in place or public health emergency, and day 180 in shelter in place. Everyone's doing good. Doctor, good to see you. Thank you for taking this time.
Yeah, thank you so much. Thank you so much. Watch yourself there with that smoke. Hopefully you're going to clear by the end of the week, and please feel free to reach out if there's any concerns. We're here to help anybody who needs it.
And we'll keep everybody updated.
Yep.
Thank you, Doctor.
Thank you, Freddie.
Yes,
Thank
yeah.
you.